Hello everyone, and thank you for tuning into Conf42. I'm Satya Manesh Veerapaneni, and I'm today excited to walk you through how predictive analytics and machine learning are not just enhancing but fundamentally reshaping the way we approach population health. In the next few minutes, we will look at how data, when used intelligently and ethically, can drive not only better healthcare outcomes but also more equitable and cost-effective systems. We will cover the challenges we face, the methods we are using, and the impact we are already seeing in real-world population. The population health challenge. Let's begin by addressing the core challenge. Across the healthcare ecosystem, around 60% of organizations struggle to identify and proactively manage high-risk populations. This is not due to the lack of will, it's often due to the data silos, outdated infrastructure, and limited access to integrated tools. Proactive care, enabled by the right analytics, has been shown to reduce hospitalizations by 25% and improve preventive care adherence by 30%. We are talking about a real shift from episode care to continuous personalized support. And these insights come from diverse healthcare studies conducted across 35 states, leveraging data from the CDC, CMS, and institutions like Mayo Clinic and Kaiser Permanente. The 360-degree patient view. To make predictive care effective, we must start with a complete 360-degree view of each patient. We do this by integration three key types of data: clinical records from EHRs, utilization and cost data from TAPes, and social determinants of health, or SDOH. By combining these, we gain not just a medical snapshot, but an understanding of the context behind a patient's health, their environment, income, education, even housing stability. With advanced ETL pipelines, secure API gateways, and HL7 FHIR compliance, we ensure this data is both protected and accurate, validated over 99.7% of accuracy. The result? A foundation we can trust for making life-impacting decisions. Risk stratification models. Next, we apply risk stratification using supervised machine learning models trained on over 8.5 million patient records. We evaluate over 3,000 variables, including lab results, medication adherence, utilization patterns, and even socioeconomic inputs. We use algorithms like random forest and gradient boosting, which have outperformed traditional logical regressions, delivering 87 to 92% prediction accuracy in anticipating hospitalization within a 6-month window. This lets us bucket patients into 4 tiers: high risk, rising risk, low risk, and healthy. Each tier received a tailored intervention plan, from intensive care management to wellness and education initiatives. This personalization at scale is what moves the needle in population health. Predictive analytics. The results speak volumes. In studies over 30,000 patients comparing to predictive models to traditional core, readmission dropped by 24%, ER visits decreased by 30%, overall health costs reduced by 20%. Perhaps more importantly, patient engagement increased by 40% with higher appointment attendance and better follow-through of care plans. All of this was achieved using statistically significant method of A/B testing and prosperity score matching, ensuring the outcomes weren't just anecdotal. Predictive analytics isn't just about risk scores, it's about outcome, impact, and equity. Geospatial healthcare analytics. One of the most powerful and sometimes overlooked tools in our arsenal, geospatial analytics. Using GIS technology, we map disease prevalence, resource usage, and care access across gaps entire regions. With this insight, we have helped organizations identify healthcare deserts, designing mobile outreach programs, and even optimize where to place new clinics. For example, by using catchment area modeling and isochron maps, we improved facility placement efficiency by over 40%, reducing both patient travel time and operational strain. This brings precision to population health. Right care, right place, right time. Machine learning applications. Let's not dive deeper into how machine learning fits into this equation. We aggregate vast data sets from EHRs, labs, pharmacy records to socioeconomic indicators. Our models range from decision trees to deep neural networks. They uncover patterns that would take years to identify manually. For instance, one model flags patients at risk of readmission based on subtle combinations of medication refill patterns and prior claims data. What's key here is not just prediction but interpretability. We ensure clinics can understand why a model made a recommendation, fostering trust and adoption. Case study: chronic disease management. A perfect example comes from a regional health system serving 150,000 people, mostly between the ages of 45 and 75, with a high diabetics burden. They implemented our predictive platform focused on HbA1c trends, medication, adherence, and social data. Over 18 months of diabetic admissions dropped by 42%, thus saved 3.2 million annually. Even more powerful was the feedback loop. Real-time patients' outcome were fed back into the system to continuously adjust care plans. It's not just a dashboard, it's a living or learning system. Addressing healthcare disparities. A core value of this work is health equity. Using SDOH and claims data, we identify undeserved population based on a zip code, ethnicity, income, and access to care. We partner with local organizations to design culturally sensitive outreach programs like mobile screening vans and translated education materials. We also monitor equity KPIs to track the long-term success of these interventions. Analytics isn't just for efficiency, it's for about fairness and inclusion. Implementation roadmap. Implementing predictive analytics isn't a plug-and-play task. It requires structured roadmap. Data integration, connection EHR claims and SDOH sources securely and consistently. Analytics deployment. Test and refine predictive models, train staff on BI dashboards, workflow integration, embed insights into real-world clinical processes without disruption. Continuous improvement. Use a POSA, plan, do, study, act, loop to recalibrate models and expand reach. Change management is key. We work closely with stakeholders to ensure clinicals are supported, not overwhelmed. Key takeaways. Let's recap the core insights from today. Integrated data creates a complete patient view. Predictive analytics shifts care from reactive to proactive. Geospatial analytics adds geographic precision. Machine learning powers smarter, faster decision. And equity must remain front and center. We are not just building models, we are building better healthcare future. Thank you for so much time in joining me. It's an exciting time to be in healthcare technology. With the right tools and frameworks, we can transform not just systems but lives. Let's continue building healthcare system that are intelligent, inclusive, and truly impactful. Thank you very much. Thanks for joining me at Conf42. Have a good day.